Let's talk lungs with Trent and Lori from Lung Saskatchewan. Dedicated to connecting you with lung health experts and key opinion leaders who will share current, evidence-based lung health information to inspire you and those you care for to take your best breath. This podcast is recorded on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, as well as the territory of the Métis.
On this episode of Let's Talk Lungs, we will be speaking with Dr. George Zhanel. Dr. Zhanel is a microbiologist and pharmacologist who is presently professor and associate head of the Department of Medical Microbiology and Infectious Diseases at the Max Rady College of Medicine at the University of Manitoba. Dr. Zhanel is the research director of the Canadian Antimicrobial Resistance Alliance, also known as CARA, and is also the founding and chief editor of the CARA website.
This episode of Let's Talk Lungs is sponsored by Pfizer Canada. Pfizer Canada is the Canadian operation of Pfizer Incorporated, one of the world's leading biopharmaceutical companies. Pfizer strives to profoundly impact the health of Canadians through discovery, development, and the delivery of medicines and vaccines. Their diverse portfolio offers a broad range of benefits and solutions to meet the needs of Canadians.
Well, thanks for joining us for today's episode, Dr. Zhanel. RSV, pneumonia, influenza, and most recently COVID-19. That's a lot of respiratory illness out there and a number of vaccinations now available to provide protection. So we do want to thank you for taking some time to walk us through the what's what in respiratory viruses and what we should know about how and who should be protected. But before we get into viruses and vaccines, why the interest in microbiology and pharmacology? Why is this such an area of interest to you?
Trent, I'm delighted to be with your listeners. I'm one of these very fortunate people in life who likes what they do and can't wake up in the morning to go to work. I was trained in two different areas. One is medical microbiology, where I'm interested in infections. But I'm also interested in pharmacology, which is vaccines and antibiotics. So I've had the luxury for 35 years to put together interest in infections, interest in vaccines, and looking through two different lenses, the microbiology and the pharmacology lens, to try and solve problems.
Well, that sounds like the perfect fusion of entities to have our conversation today. Now, we've heard about viruses like influenza and pneumonia for quite some time. COVID-19, relatively new to us, and although not new, we are hearing more and more about RSV. Can you tell us a little bit about how and why respiratory viruses have come to be and why new ones are maybe hitting us?
So let me focus on RSV. Some people think it's a new virus, but it's not. We've known about RSV in kids for a very long time, that it causes problems, but we also know it causes a lot of problems in adults, especially older adults. But we really had nothing to offer you. So we've never talked about RSV in adults, but now we do. We have several new safe and effective vaccines. So now we're spreading the word that RSV infection is around and we can prevent it using vaccines.
So talk to us. Let's focus a little bit on risk factors. Who is the most at risk of illness due to respiratory virus?
So when I talk about the word risk factors, I mean if you get the infection, you have a really good chance of getting really sick enough to go see the doctor, or sick enough to have to go to the emerge or urgent care or get hospitalized or even go to the ICU or dying. So that's what I mean about risk, getting really sick. And there are three main groups we focus on. Patients who are older. 2, individuals who are have chronic medical problems, liver disease, lung disease, kidney disease, heart disease, diabetes, high blood pressure, and then people of any age whose immune system is compromised due to disease or drugs. So older age, patients with chronic medical problems, and patients whose immune system is compromised. Those are the big three when it comes to risk factors.
All right, shifting gears just a little bit, Dr. Zhanel, let's talk about protecting ourselves. Other than vaccinations, and we do want to talk to you about vaccines in more detail, what are some general things we can all do to protect ourselves from respiratory viruses?
Lori, in the olden days, I was raised by Eastern European parents. They said, if you're really sick, go to work. show the boss that you're not scared to go to work when you're sick. That was the stupidest thing in the world. Now we know that if you have a respiratory illness, whether it's a cold or flu or RSV or COVID or pneumonia, you should not be going to work. You should not be spreading around to your friends and family and fellow students. So if you really need to go to work or school, put on a form-fitting mask, put on a nice N95 and then go out if you need to do. But ideally, don't share it with others. And then the rest of it is just, the usual stuff. Try and stay healthy by eating well and drinking lots of water and sleeping and washing your hands and staying away from sick people. But vaccines are a practical way to try and prevent doing this. So that's why I'm focusing on vaccination.
Yes, that's wonderful. We've often talked about silver linings in the pandemic. And if there's a silver lining, it definitely has taught us to stop being heroes and stay home from work when we're sick. So you're very on point with that. Dr. Zhanel, we're going to take a short break and get right back to our conversation with you. Lung Saskatchewan has long been associated with leadership in lung health education. Whether you enjoy watching a webinar, a video, reading information online or in print, or listening into a podcast like this, Lung Saskatchewan has education to meet your needs. Find out more at lungsasc.ca. Welcome back, listeners. We're learning a lot about respiratory viruses today on our show with Dr. Zhanel, and we're just finished talking about some of the more general things we can do to protect ourselves. Dr. Zhanel, let's dig a little bit deeper into vaccines. First off, can you give us a Coles Notes version on how a vaccine gives us protection?
Yeah, so Lori, we know that Canadian kids are amongst the healthiest kids in the world. And the reason is we get them off to a really healthy start by vaccinating them against things like measles, mumps, and rubella, and polio, and smallpox, and all these other infections to get them off to a healthy start. But growingly, we now have many vaccines that we can give adults. And why are we giving adults vaccines? To keep them healthy, to keep them living independently and enjoying their lives. That's the Coles Notes version.
Dr. Zhanel, let's talk about that a little bit. The vaccine schedules, when to get what differs depending on the virus. So let's spend some time talking about influenza and pneumonia. Why are influenza or flu vaccines recommended annually and the pneumonia vaccine on a different type of schedule?
Well, you're right. When it comes to the flu shot, there's a different shot every single year. And the reason is we give it annually in around September, October, November when the vaccine comes out because it's the latest formulation. The flu virus keeps changing. Every year it changes. And so we make the newest, most current version every September, October, November. But secondly, when you give a flu shot, the protection only lasts about 6 months. So we like to give it ideally every fall or every winter with the most current viral strains and making sure that we have the optimal protection during the respiratory season.
So let's hone in a little bit on pneumonia. And we know that there are several pneumonia vaccines available. Which one or ones are recommended for who?
So right now there are two really good pneumonia shots. One is called PCV20 or Prevnar 20, and another one is called PCV21. These are both good pneumonia vaccines. The advantage of the Prevnar 20 is it not only lasts for 5 years, but it's very good preventing pneumonia and really serious pneumonia, and it's paid for by the government if you're older or have these chronic medical problems.
And is there an order to receiving them if more than one is recommended?
So the order is that if you've had one of the older pneumonia shots, and your listeners would have heard of terms such as Prevnar 13 or PCV 15 or Pneumovax, the old pneumonia shot. Those are inferior these days because we have these updated, modern, more effective vaccines. The order would be if you've had any one of those, wait a year. And anytime after a year, You can get now the Prevnar 20 or the PCV 20 vaccine, and you'll get optimal protection for at least 5 years.
So earlier on the show, we did talk about those that are most at risk of illness related to those respiratory viruses. So can we assume those most at risk are those people that should be vaccinated?
Absolutely. So when it comes to, for example, RSV vaccines or the pneumonia shot or even COVID and flu shots, the greatest risk are patients who are older, individuals just by age. They're 65 years of age and older. They should all get these shots. If you are younger than that, if you are 30, 40, 50, 60, but you have chronic medical problems, your lungs are affected, your kidneys, your liver, you've got diabetes, you've got heart disease, high blood pressure, you're at risk to get serious illness. You need RSV or a pneumonia shot or even a COVID booster. And if your immune system is just not working well, of any age, you're 18 years of age, you're 30, you're 50, you're 70 years of age, but you're immune compromised, we need to give you these vaccines to protect you so you don't get seriously ill and have to see medical care.
I'd like to talk a little more about RSV in particular. This has long been associated with infants, but now we're talking about RSV in older adults. Can you talk to us about this, infant risk versus adult risk?
It's true that we've known that infants get very, very sick, can even die if they get RSV. But the good news now is we have an RSV vaccine that we can actually give to pregnant mothers. So they're 32 to 36 weeks pregnant. We can immunize the mothers. They make antibodies. They pass those on to their infant in utero in pregnancy. And when their baby is born, the baby is protected with antibodies they got from the mother. So this is, these are great vaccines that are safe and effective, and we can protect kids right away. Now, if the mother doesn't want to get a vaccine in pregnancy, then there's a different strategy. If these children get sick with RSV, we can give them a different type of therapy called an antibody and try and keep these kids sick. I like vaccinating the mom and let it be natural, where the mom makes the antibodies and gives them to the baby. But we can also do what's called this passive immunization, where we just inject the kids with these antibodies if they get sick. So there are different ways to go.
This is definitely fascinating conversation about vaccine protection against RSV. So, in your opinion, is science catching up? Is science actually allowing us to create better technology and better vaccines?
There's no question. Technology is both our friend and our foe, right? We hear all these scary things, how AI is going to cause bad things, but technology is a great thing when it comes to medicine. We're able to make better vaccines, better RSV vaccines for adults, better RSV vaccines for pregnant women so they can protect their offspring. And this is just technology allowing us to create very safe vaccines that are very, very effective, and especially preventing severe illness in those at greatest risk.
Okay, well, I'm going to throw a big loaded question at you. So, with so many respiratory viruses out there and numerous vaccines available, and certainly more likely in production, how do you answer this question? Which one or which ones are right for me?
It's a great question. I think you can do it two ways. If you're lucky enough to have a family doctor, or you have a nurse practitioner or nurse caring for you, or you have a good relationship with your community pharmacist, you can ask them and say, for me, do you think I should get an RSV vaccine? Should I get a flu shot? Should I get a pneumonia shot? Should I get a COVID booster? And they can guide you. But if your listeners are in one of three groups today, they are older, they're 65 years of age and older, they are at risk for these respiratory infections just because they're older. As we get older, our immune system doesn't work as well to help us. So they need these shots. If you are a adult who's 30, 40, 50, 60, but you have chronic medical problems, you have some lung disease, kidney disease, heart disease, liver disease, diabetes, high blood pressure, these are high risk groups to get really, really sick. So it would be really great if they got vaccinated. And the third group is, again, if your immune system is compromised. So you're an adult, you're 20, 30, 40, 50, 60, 70 years old, but your immune system is compromised, perhaps because you have HIV or you have cancer or you're getting radiation or you're on steroids or you're on one of these biologics. There's so many reasons why Canadians are immune compromised these days. You would really benefit from these vaccines and they would help to keep you healthy.
Well, doctors, and now we are getting to the end of our time together, and it is time for some final thoughts. Can you leave us with some key messages about infectious respiratory viruses and vaccines? You've reiterated a number of times our risk groups, but leave us with those final thoughts.
Trent, I'll give you a quick story. My mother's 88 years old, and I love her madly. She was a nurse for 55 years. And she lives alone, independently, does her own cooking and cleaning, and goes out with her girlfriends every day. And they have happy hour, and they go to old folks' homes, and they talk to old people. They love their lives. But my mom, unfortunately, at times is a bit of an anti-vaxxer. So when I say to her, let's go see your family doctor to get your flu shot or your RSV shot or your pneumonia shot or your COVID booster, she says to me, you know, son, I don't think I need them. So growingly, what I tell her is, let's go get your shots so you don't have a stroke or a heart attack. And she gets terrified. She says, what are you saying? And I tell her, the latest research is if you get an RSV vaccine or a flu shot or a pneumonia shot or a COVID booster, they won't just protect you from getting these respiratory infections. The latest data shows that they will actually help prevent you from having a stroke or a heart attack or heart failure. Because we now know that when you get these infections can not just cause a bad infection, but they can affect the heart and affect the brain. And it can lead to serious illnesses such as heart attacks and strokes and perhaps even dementia. So now she just heads over to the doctor to get her flu shot, her RSV, pneumonia shot, COVID booster, because she wants to stay healthy. And she knows that they may also protect her from really scary things like stroke or a heart attack or potentially even getting demented.
Well, Dr. Zhanel, what a fun conversation. It's not too difficult to hear the passion in your voice for your science. And we can't thank you enough for being part of this episode of Let's Talk Lungs. Your leadership in the field of infectious diseases, particularly respiratory infections, plays such a vital role in protecting those most at risk. So grateful for the important insights you shared today and really, really appreciate you taking time to be with us.
Trent and Laurie, it was a real honor for me. My last words is I know that Laurie's been really carrying the heavy load there, Trent, in your twosome, but I think you're great as well.
Thank you.
Thank you so much, Dr. Zhanel.
Thanks for joining us.
Greatly appreciate it. We'll hope to connect with you again.
Thanks for listening. If you enjoyed this episode and you'd like to help support LungSask's Let's Talk Lungs podcast, please share it with others. Post about it on social media. Like, subscribe, hit that notification bell for new episodes, and leave us a review. Follow LungSask on Instagram @LungSask and on X @LungSask. That's all for this episode. See you next time.
Produced at
Sound Lounge by T-Bone.